Waving, beautiful, beautiful. Okay, Pacific Palisades, wonderful, a beautiful location on the planet. It's my pleasure to share with you my speech today. An honor. It's a complete honor to be with you and to share that with you. Um, the purpose of my speech today is really to speak to finding mental wellness and finding productivity and really speaking to the proven, surprising, most important secret sauce for stepping in front of the line, and really finding your true voice and making a difference. So, in the next 20 minutes, we're going to really take a look at what's in the way of you being heard, what's in the way of you being heard for the person that you really are. Now, I'm sure you'll agree that in the last couple years, and really even before that, mental illness and mental health have become very, very hot topics on the planet and in our community. And maybe it's now more than ever. So, what are the costs of mental illness in the community right now? What are some of the costs that you're noticing of increasing mental illness in your community? Anyone? All right. Well, some of the costs might be that a decrease in productivity or a decrease in communication or an increase in world and community problems. And we're all seeing that. And access to mental health assistance is also seemingly closed off and contracted. So, what does the future look like if we don't do anything about the rising concerns regarding mental illness? All right. The future the future, if we don't look like, is we're gonna get more of the same, and it's gonna get increasingly worse. So, if we could bring mental wealth to the people quickly and effectively, who wouldn't have to wait in line, or you wouldn't have to use insurance, or wouldn't have to get a new diagnosis, or start any new medication, or miss out at work or at home, or they would stop making some really destructive, damaging decisions, that would be pretty valuable, and that's what we're gonna talk about today. You see, the way I see it is the greatest threat in the world today is not at all what you think. The greatest threat in the world today is not about a virus, and it's not even about climate change. Frankly, it's not even about racism, and it's not even about sex trafficking, and frankly, it's not even about war. Now, all of those things are massive threats to humanity and to our planet. But we have an even greater threat. And that greater threat is we are collectively giving up our right to our true voice. We are either having it taken away from us in some very unfortunate circumstances, or we're giving up and choosing not to speak what we know is our truth. Why is that a great threat? Because all the problems that I just listed aren't going to be dealt with unless we bring forth a major conversation as a human family. Today, we're going to take a look at what are some of the things we can do to be heard, to bring our true voice forward. Imagine today was the last day of the rest of your life, that you just learned that this is it. Today is the end. What would you do with the time between now and then? Now, if you're like most people, you would go and find someone in your world and tell them your truth. You would say something like you love them, or you care about them, or you would thank them for having been with you. Or maybe you would call an old friend and tell them you stole $20 from them 10 years ago. But you would find a truth and you would let people know. That's having access to the importance of our truth. Even when backed into a corner, we would find a truth and share it. See, without a voice, you will never be heard. And you can be hearded. Without a true voice, you will never be known. But with the true voice, you can find healing and peace and love. In fact, a true voice is what is required to end all wars. Henry David Thoreau said this: "The mass of men live lives of quiet desperation and then go to their graves with their songs still in them." That is one of the tragedies that we are experiencing in our world. Today, we're going to learn how to sing that song of yours in such a level to bring peace and harmony to the world around you and to yourself. Hello, my name is Dr. Fred, and I'm affectionately known as the Undoctor. How did I get that name? Well, over time, I began to undiagnose people, unmedicate people, and then undoctrinate people, pulling people from the clutches of the mental health facilities. I am a psychiatrist and I've practiced around the world. I've had over 40,000 patients and I've written medication over 100,000 times. But that's not the only thing I am. I also am a two-time college dropout. I was born 64 years ago to a family that was in total disarray and chaos. And they were expecting little Freddie to bring joy and peace to their world, to bring connection and communication. I think when I arrived, I did a pretty good job until my brothers, 10 and 14 years older than me, got a little bit irritated with me. But that's a whole different story. They were responsible for giving me a life for which I was quite precocious. I knew how to read and write by the time I went into kindergarten, and I had access to simple math and early multiplication, and that's what I wanted to do. But I also loved communication. I could see how the four adults in my family would communicate and actions would take place, and I wanted to be a master of communication. When was I going to learn how to communicate? I thought. It certainly wasn't in kindergarten, so I figured it was in the later years, maybe late in elementary school, the big kids, sixth grade. Well, it didn't happen then, and it didn't happen in junior high. And frankly, it didn't really happen in high school either, because high school didn't encourage open discourse, which is what I meant when I said communication. So I made it my business to go to college, and I went to my local facility, the one with the great helmets, the one that I had been born and raised to think was the best school in the world, the University of Michigan. At the University of Michigan, I was there for a year and a half, and open discourse was the last thing that was expected in the engineering school. In fact, what we did was we listened and watched the professor say and do things we had never heard before. And if we could memorize it word for word and then regurgitate it, they would call us a good student and move us into the next grade. The last thing from open communication. Eventually, I realized that that wasn't going to be where I communicated, and I wanted to learn, so I dropped out. And not only did I drop out, I got on a Greyhound bus and came all the way to California from Michigan. I hung out in Berkeley, California for the summer at a youth hostel, and I learned a lot about how to communicate, but I did not have a job. And when I called home, my family convinced me to come back to school and get a degree and then go back out and find myself. So off I did, sauntering back to the University of Michigan, who had the only computer in all of Michigan. And I was now going to study computer science. There was a 2-acre facility and it was open all night called the computer room. And we used to do these punch cards and we sat there all night and just would submit these punch cards and hope that our program ran. Well, this life was not something based on communication either. So eventually I dropped out again and went home and told my family I was never going back to college again, ever, that it wasn't where I was going to communicate. My mother was in some degree of approval with that and told me that it's okay not to go back to college, but I still would have to get a job. So I got a job with her assistance at a local state mental health facility for adolescents. I was a child care worker. And at that job, I began to communicate with these kids, these human beings, these people walking through life just as much as I was, 6 or 7 years younger than me, wondering what was there to do and who were they to be. In the form of communication, I was finally getting paid, and I loved that job. I simply just adored the job of being with those kids, being with those troubled folks, and really communicating and learning with them. But there was one part of the job that I absolutely despised, and that was the way that psychiatry was treating those kids. You see, sometimes Timmy would be up too late, or Johnny and Jimmy would get into a fight during the day, and we would call the psychiatrist and let him know we were having trouble. So the psychiatrist would come out of his call room and walk down to the unit, and then have a conversation with Jimmy for about 3 seconds, and then with me for about 7 seconds, and then with the nurse for about 20 seconds. And then he'd take out his weapon, which looks something like this, an ink pen, and he would write something into the chart. Then it was our job as childcare workers to go haul Jimmy up and then take him to the quiet room and hold him down against him screaming and kicking and spitting and biting and swearing, and pull a little bit part of his hip down so we could expose his hip and then give him a very large dose of an injectable sedative medication. And that, by the way, is still going on in most psychiatric hospitals around this country. It was a horrible experience for me, and I had to do it way too often. I found it to be heinous and barbaric and nothing close to the communication and acceptance that I had for those children. I eventually got so disturbed by this that I decided I needed to go back to school and learn how to be a psychiatrist and bring communication and connection to the center of that field again. So that's what I did. And 13 years later, I was graduated with a residency in psychiatry and a fellowship in child and adolescent psychiatry, practicing as a childcare worker the entire 13 years. Now, unfortunately or fortunately, right in the middle of that time in 1987, and some of you will remember this, there was an introduction of an important paradigmatic shifting agent to the psychiatric world. Prozac was introduced to the world in 1987. When that happened, there was all of a sudden a new way of looking at mental health. Biological psychiatry was born, and chemical imbalances were thought to be the explanation of any time a human felt uncomfortable about anything. So, in fact, discomfort was thought to be wrong and sick, and that we had a pill to address that. So, over the next several years, Prozac and all of the drugs that came after that, and Lord knows there's been many, have been utilized to address what we thought was discomfort and therefore pathology. So as I graduated, I now was a medicator. I now was being counted on to deliver medications and diagnosis to the exact population that I thought I went into school to prevent doing that. The last thing I wanted to do was learn how to medicate people, and now I was becoming a world expert in doing that. That is called living duplicitously. That is called actually doing what I was asked to do rather than what I knew would be more effective. And I did this for years and years. In 2006, I eventually got too much. It was too much. I had seen too much. I had signed off on too many things that I was not aligned with. And I call this my true voice moment. What I ended up doing was something that at the time was thought to be quite radical, and frankly, even now is thought radical. And that was started taking people off of medication and taking them off their diagnosis, and then actually connecting and communicating with them and giving their lives back, and they reliably got better. I did this for tens of people and then did it for hundreds of people, to the point that they no longer needed a psychiatrist in order to get through life, and in fact had found a newly reoptimized life of freedom and power. Now, this was something different than what my colleagues was doing, so I was left in a funny space. But I knew that I had finally become a healer rather than a doctor. And this is where I've been for the last 15 or 16 years. Now, I ask you, where in your life are you still being sort of like a doctor, doing what you're told rather than what you know, which would be like a healer? So, where are you still being a doctor rather than a healer? This is what this talk is intended to look at. Now, you might notice some places where you're actually doing things that are misaligned with who you know yourself to be. You can forgive yourself for that. We all found a space to learn that not being ourselves often paid dividends when we were growing up. We learned that if we faked something or we exaggerated something or we blamed someone else for something we did, there could be some short-term benefits. And then the crack in the cement got larger and larger, and we didn't go back and repair it. And now many of us are living that life of quiet desperation with our song actually unsung. And that's the bad news. But there is good news, and the good news is right here, right now, today, we can make a definite positive difference in that area of life. So we'll consider a few principles. Number one, pretending to be someone that you're not in order to protect yourself for who you are is both ineffective and ludicrous, even though we all do it to some extent. Number two, that goes along with number one, is you don't have access to a lot of things in the world, but you do have access. You do have a say in what you say and what you do and who you are. Meaning you are not an entire prisoner to the habits that have brought you to this point in your life, no matter how old you are, no matter how ingrained those habits are. You can do something different in the next minute than you've done any time in your life. That is super exciting. Number three, the secret ingredient to all this is in listening. I invite you to understand that what's really called for in true voice is to listen to the person or the people that you're with and what's being called for contextually in the circumstances that you find yourself in. True voice is not the same as just blurting out or screaming from the mountaintops or telling your sister in law that you don't like her or that you disagree with some little aspect of what she thinks. True voice is about moving a needle forward, about taking actions that have an intentional outcome and using creativity to express yourself effectively. That's what true voice is about, and that's what I stand for. You see, you already are an influencer, even if you don't have a million followers, even if you don't have $1 million. And as an influencer, you will be applauded. Now, you might be applauded out loud, or you might be applauded in the hearts and minds of those people that you're with, because authenticity is contagious and infectious. People want authenticity more than they even want agreement. Have you ever noticed that someone who's opposed to you in the content still becomes worth listening to when they're authentically speaking from their heart? Authenticity is the route towards connection and towards resonance with others. Speaking your true voice not only brings you capacity for peace and love and respect, but I say that true voice is all that's necessary in order to end all wars inward and outward. So give it a try. Now, the voice that you have in your head right now, wondering whether I'm worth it or you're going to do anything, that's not really a true voice. That's a monologue. In order to do this, you're going to have to do it with other people. So I invite you to take incremental steps towards your own authenticity and ingenuity, as well as your true voice and your core message, and speak a little closer to it the next time you have conversations with the people in your world. You will see that you find the power and freedom that comes to that and that comes with that. So, welcome to your true new life. Welcome to a new level of love and listening. Welcome to peace inside and out. Welcome to humanity and welcome to your true voice. Voltaire said this best: I may disagree with what you are saying, but I will defend to the death your right to say it. Now, being that you're from Pacific Palisades and you've been such a good crew so far today, I'm going to offer you a copy of my new book, which I just wrote 2 months ago. And it's super exciting to offer this. It takes a deeper dive into this whole notion. And the name of the book is shockingly Find Your True Voice. Now, you can find this at findyourtruevoicebook.com. And if you sign up there, I will send you a copy of my book this week. And if you'd like to talk further with me about it, you can find me at Dr. Fred at welcometohumanity.com. I'm sorry, welcometohumanity.net. It's Dr. Fred at welcometohumanity.net. And for the last thing, I'd like to tell you about a summit that I'm involved in. I have been hosting a summit these last several weeks, and it goes on through the rest of this month. The summit is called the We the People Summit. And I have assembled a group of amazing influencers from around the world. Some of them are very well known, and maybe even you've heard of them. And they're here to talk to us about what it takes to become an influencer. To a person, each of them say essentially the same thing, which is that finding your true voice, finding your authentic self, and then aligning with it is the access to becoming an influencer. The truth is, you are already an influencer just like you are. You are when you speak your true voice, you heal the world, even if it is to one person or a crowd of 6 or 12 or 100 or 1,000. The opportunity to speak your true voice is here every day, and I invite you to take that on. Thank you very much for allowing me to speak with you this afternoon. It is a deep pleasure. I'm up here in California as well, in Northern California, in Grass Valley, in the foothills of the Sierra Mountains. And I sometimes get down to Santa Monica. In fact, I thought I was going to go today, but I did not. It's really an opportunity, a real pleasure to speak with you today and to allow you and to have you allow me to be here after your lunch. I'm now open for any questions or comments, anything anyone else has to say. Thank you very much again for your time and your generosity. I don't hear anything now. If anyone's speaking, I don't hear. Uh-oh. Hi, I see you, but I don't hear anybody. Yeah? You for a moment there, you came in. All right.
By speaking.
Can you hear me?
Yep, I can hear you now.
Okay, it's going to be a little echoey, but we'll try.
Okay. My question is this. You can speak with a person with a mental problem and you don't have a problem with it. You can communicate. But the person with a mental problem, can he later communicate with normal people?
So are you asking if someone has a mental problem, can they later communicate with normal people? Normal people can speak with someone with a mental problem. The question is, can a person with a mental problem speak with normal people? Yeah? Is that what you're asking, sir?
Yes.
Okay. Yeah, for sure they can. One of the things that I noticed, especially when I began to take people off their medicine and their diagnosis, is that more than anything, people really just want to be heard. And this was true in the state hospital. And this is also true with this population that we think is mentally ill. Oftentimes, the treatment actually perpetuates the symptoms it's marketed to treat, unfortunately. And what people really want more than anything is to be heard. And it's amazing the miracles that can happen when someone is heard and then they start speaking their truth when we're listening for them. So, absolutely, people with so-called mental illness can communicate effectively with those of us who think we don't have mental illness.
Thank you.
You're welcome.
What else would like to ask Dr. Moss a question? Please ask the iPad.
Any more questions from anybody? Everybody nodded no, so I think that's all for the questions.
Okay. Well, I want to say
Alex?
thank you. I want to say thank you, and I want to let you know that this is now my life's work to pass this message on to groups of all sizes. So if you know of anyone in your community where you think they could benefit from this conversation and from learning a little bit more about how they can speak their true voice and be heard in areas where they're no longer being heard, that's what I do for a living. And it would be great if you wanted to tell Kimberly or myself on the evaluation form of places where I can also deliver the same message. So thank you again for the opportunity.
Thank you.